Let's take a look at the cardiovascular system and some of the changes that happen here. So there is quite a difference as well. So if you think about it, again, you have another being in there. So more blood is needed to distribute all of those respiratory gases and nutrients to that fetus. So the way that we do that is we are going to have to increase blood plasma. Again, 50% increase in blood plasma. And in order to pump that around, we are going to have to increase cardiac output. How do we increase cardiac output? You guys remember cardiac output, right? Because I wrote it on the videos over and over again, and I don't remember. So no, here it is. Cardiac output, I was getting ahead of myself, is heart rate times stroke volume. So that is going to cause a pregnant female's heart rate to increase as well as stroke volume. So we can make sure that this blood gets to where it needs to go. It's also going to change blood pressure. So we talked about that whole issue. Whenever you do increase blood volume, remember you have that risk of increasing blood pressure. So it will initially increase in that first trimester. However, usually in that second trimester, blood pressure will drop. And the reason why, it's because you have this kind of decreased peripheral resistance. Remember how that is going to help cause a drop in blood pressure. And the reason why is because usually there's a decrease in blood viscosity and also a decrease in the sensitivity to angiotensin, which remember we talked about that in the kidneys. So, and there could be pregnant females where this might not happen, where they might not have that decrease in blood pressure. And we'll talk about that, what happens if their blood pressure doesn't increase. Other things, later on in the pregnancy, as that fetus gets larger and larger, it's going to start to compress some of those abdominal vessels of the fetus. So one reason why they tell pregnant females not to lay on their back when they sleep is because that fetus can go in and, of course, compress that abdominal aorta in the back. So always make sure you sleep on your side. But the problems with compressing the abdominal blood vessels is, of course, it can impair venous return from the lower body. So that's going to cause, of course, fluid buildup, or blood buildup and fluid buildup, of course, down in the lower limbs. And remember, that's going to cause varicose veins. We talked about varicose veins way back in one of those earlier chapters, I think chapter 20. But also hemorrhoids, and then, of course, there's that edema that I just mentioned. So let's talk about whenever high blood pressure does not decrease after that first trimester. This is called preeclampsia. And some of the risk factors is if the pregnant female was already obese when she got pregnant, or if they already had diabetes. If the mother is a little bit older, or the female's a little bit older when she got pregnant, that can also be a risk factor. And if the pregnant females had preeclampsia before. They're not 100% sure what causes preeclampsia, but what happens with it is that the fetus does not get enough perfusion. It's not getting the adequate blood flow to tissues. So the only way to cure it is, of course, delivery, is giving birth. Sometimes they will prescribe bed rest, medications, but a lot of times they will have to induce the labor early in order for it to be relieved or to cure it. Eclampsia is going to be where the female's blood pressure is so high that it is causing seizures, and that's, of course, a medical emergency. Definitely the fetus has to be delivered immediately. So now let's talk a little bit about our respiratory system changes in the pregnant female. So the expanding uterus is actually going to prevent that diaphragm from being able to fully descend. Remember, that's going to help us get that nice breath of air in that we need, which that is, of course, going to cause problems with exhalation as well. And another thing is that as that fetus gets larger, it's also going to push like the stomach and things against the diaphragm. So all of that is going to cause to where the diaphragm's not able to fully distend. So this can cause dyspnea. And that is, of course, where you have that kind of shortness of breath. Another thing that could happen is nosebleeds can happen more often. Estrogen also increases mucus production. So females can be a little bit more congested than normal. Progesterone increases brainstem sensitivity to carbon dioxide. So what this does, this is really important because it's going to lower the blood oxygen levels in the pregnant female's bloodstream. What this does is it causes a gradient between the fetus that's going to have a little bit higher CO2 levels and compared to the now pregnant female that has lower than normal blood levels. So do you see how this is going to encourage it to go, the carbon dioxide to go from the fetus to the mother's bloodstream? That way we can exhale it. Because remember, that's how the fetus is going to get rid of carbon dioxide. It has to go down that concentration gradient. So that's going to help facilitate that diffusion. And of course, there's other things like tidal volume, pulmonary ventilation, respiratory rate, oxygen consumption. Those are all going to increase as well. I mean, if you have more iron, then it's really not going to be important if you don't have more oxygen in the bloodstream. So that's why we're going to have a little bit more respiratory rate as well. So urinary system changes. Remember, we increased blood plasma levels by 5%, which means that it's going to have to go through the kidneys. And we talked about how if we increase this blood volume, that's going to increase blood pressure, which that is going to increase glomerular filtration rate. Remember how we talked about how if you increase glomerular filtration rate, that increases urine volume? That's why pregnant females are going to urinate more, is because of that. Not early on, it's not necessarily because you have this uterus that's pressing against the bladder. Is it? Yeah, but it's not that big at this point. It does contribute to a small amount, but it's more about that whole increased blood plasma volume, increasing that glomerular filtration rate. Another thing is that the ureters and the renal pelvis are going to dilate, so urine might be kind of staying inside of the ureters and the urinary pelvis, that urine stasis. And the ureters are sometimes compressed by the uterus. Pregnant females are going to be more prone to urinary tract infections as well. So this is a nice little chart. Look how cute it is. She's kissing her mom's little belly here. But it's going through all of the hormonal changes, the uterus, hypertrophy. It's talking about the anterior pituitary. There's a nice little picture that we looked at earlier about HCG levels. There's that compression on the bladder, more frequent urination. Specifically, of course, again, it's because more the glomerular filtration rate, but also later on in that pregnancy, yeah, you do have this big old 8-pound baby that's pushing on your bladder, and it's going to make you go to the bathroom a lot more often. So that's definitely going to increase in that last trimester. Weight gain, we already talked about. Constipation. Don't forget that spine is you're going to have that kind of sway back, and it has to do with gravity, being able to offset that center of gravity a little bit. And that is called lordosis. The way that I remember lordosis, as opposed to kyphosis, is if you think about how pregnant females, oh Lord, my back hurts, right? So you can try and remember it that way, or you can just remember, hey, it's just lordosis, whatever you want. And then, of course, there's the blood volume and then the hair. So there's some positives and negatives to pregnancy. So, ladies, you should consider it maybe or not. Maybe it's not for you. So who knows?